the surgeon and key figure in the field of personalized precision health system Galore. Stemming from his Valiathan and other honored and privileged to have you here, sir, for the inspirational speech.
Namaste everyone, good afternoon. I would like to thank Dr. Kajay sir for giving me an opportunity to share our small thoughts and ideas on how to get the two systems together. Now the idea is not to prove the superiority of one medicine over the other. It is to get the two system. ನಮಗೆಲ್ಲರಿಗೂ ತಿಳಿದಿರುವ ಹಾಗೆ ಎಲ್ಲ ವೈದ್ಯಕೀಯ ಪದ್ಧತಿಯೂ ಸಹ ಅದರದೇ ಆದ ಇತಿಮಿತಿ ಇರುತ್ತೆ. ಆದರೆ ನಾವು ಒಂದು ಟೀಮ್ ವರ್ಕ್ ಆಗಿ ಇದರ ಬಗ್ಗೆ ಯೋಚನೆ ಮಾಡಿದಾಗ ಖಂಡಿತವಾಗಿಯೂ ಸಹ ಆಯುರ್ವೇದವು ಸಹ ಬಹಳ ಎತ್ತರಕ್ಕೆ ಬೆಳಲಿಕ್ಕೆ ಸಾಧ್ಯ ಇದೆ ಅಂತ ನಮ್ಮೆಲ್ಲರ ಒಂದು ಅನುಭವ ಹಾಗೂ ಅಭಿಪ್ರಾಯ. Seeking the blessings of Shringiri Jagadguru, I would like to start today's session, where the concept of integrated medicine is very much there from many years. We know that the two systems have to come together. But the confusion is always there, how it can come together without any friction. Many a times we feel 5 medicines from modern medicine is already prescribed to the patient, and we add on another 5 medicines. This is the idea of integrated medicine. And now the idea of integrated medicine is one Ayurveda expert and one allopathy expert coming together will be giving this holistic care. But we are trying to reterm or reframe that as cooperative medicine. Modern medicine doctor should understand what is his limitation and understand at the same time what Ayurveda can offer in that situation. And Ayurveda doctors should know their limitation and get support from modern medicine doctors when they require. So we have termed as cooperative medicine, where when we start treatment from Ayurveda side, many a times patients would be on multiple medication from allopathy side, and we should know what medicine to stop immediately and what not to stop, which is very crucial for the action of Ayurveda medicines what we give. In many situations, we feel we have given the right medications in Ayurveda, but it has not given result. The reason being, we have not stopped the medicines given from modern medicine, which is not required in that particular context. So we are trying to give the idea of cooperative medicine, where the primary role or the dominant role is played by Ayurveda doctors, and when required, the help is given by modern medicine doctors. We are trying to reverse this dominance, which is now dominated by modern medicine. It has to be dominated by Ayurveda doctors, and support has to be given by modern medicine doctors. When we start treatment, we make sure that what medicines they are taking is stopped, which we recommend from modern medicine side. Only then we start Ayurveda treatment, and we'll be able to see significant outcome during COVID time. Now we are all doing campaigns for creating awareness on organ donation, organ transplant, etc. At the same time, it is very much important to create awareness regarding the reversibility through Ayurveda medicine. Whenever we say the need for lung transplant or liver transplant, we should not forget, along with raising awareness for organ donation, we can reverse it through Ayurveda. One example which I would like to share quickly: one patient post-COVID fibrosis, she developed extensive COVID fibrosis and was admitted one of the corporate hospital in Bangalore. And she was advised lung transplant, and she had already paid 10 lakh advance for it. And we are able to see the CT scan which shows extensive fibrosis and pulmonary hypertension. We say that once pulmonary hypertension is developed, it cannot be reversed. We are able to see severe pulmonary hypertension, who is a candidate for lung transplant. And within 5 days of Ayurveda treatment, I started the Pottalikalpas in Ayurveda. Whenever we talk about Ayurveda, we are comfortable talking about herbal medicine. But Rasaushadhis are a nightmare even for Ayurveda doctors to be used in a particular dose or in a particular for a particular duration. When I started using Rasaushadhis, when in mini ICU or in a high dependent unit, within 5 days, her pulmonary hypertension became mild, which is actually a very remarkable recovery within 5 days using Ayurveda medicine. What this conveys is, and the patient got discharged after 2 weeks from the hospital without lung transplant with the help of Ayurveda medicine. So what I'm trying to convey is, with the help of Ayurveda medicine, the need for lung transplant can be reversed in a span of as early as within a week's time. And many patients say Ayurveda is slow, but my parents always keep telling their patients that Ayurveda is not slow. People coming to Ayurveda has become slow. As our previous speaker said, they say when nothing is possible when they start palliative care, when chemotherapy is not working, or when the patient is on ventilator, gasping, when modern medicine has left the hope, then Ayurveda comes into picture. But our intention is from day one, we have to start Ayurveda, whatever best medicines are possible, so that we will be able to offer much better quality life to the patient. When I was working in Bowring and Victoria during my post-graduation in surgery, I was with Ayurveda medicine in intensive care unit, and we all remember that Ayush Ministry had some guidelines that mild to moderate case can be treated through Ayurveda. If severe cases, do not treat, admit the patient. And we know that there are a lot of blunders done since independence. Ayurveda doctors are, especially Shalya, just anorectal piles fistula has become Ayurveda Shalya. We are not able to operate or apply the principles of Ayurveda surgery in a bigger way, which we'll discuss soon. At the same time, Ayurveda doctors are not allowed to practice emergency condition, even though medicines are available. So that is the reason, even though my parents are Ayurveda doctors, I decided to come to allopathy side, because we can make use of these emergency conditions in a very appropriate way, and at the same time, we'll be able to show emergency care is possible even through Ayurveda treatment. The Rasaushadhis and the Potlikalpas, which are used in ICU. And one interesting case, the beneficiary was one allopathy doctor's sister. She was just 30 years. And we all might have heard of cytokine storm. She was prepared for discharge, and but sudden her saturation dropped. She's just 30 years of jumped to, within 1 hour, it jumped to 76. And very next morning, within 8 hours, the oxygen reached 91 and it was stable. The person who was actually counseled, the doctors had previous night called the family members and informed that she would survive not for more than half an hour. Such a case about Rasaushadhis, all of you may be having the fear of what about kidney and liver. I had made sure to document in many cases where to the Vaidya. They ask, are Ayurveda medicines safe or is it causing kidney liver damage? We need to have this data, what is very much available in the website. What is causing acute liver injury? If you see, most of the medicine are legally prescribed, anti-TB, antibiotics, anti-epileptic drugs, etc., which people don't talk about and people are not aware of it. So the traditional medicine, which accounts to less than around 10 to 15% of the medicine, which is actually illegally distributed by quacks. What I tell my patients is, any medicine, if it is not prepared properly, either Ayurveda or homeopathy or allopathy, can be toxic. So we should stop them prescribing the medicine which they take from medical. So henceforth, and this is what we follow, especially when we treat cancer patients and in emergency condition, we don't prescribe the medicine, we give the medicine what we prepare, especially the Potlikalpas. And as the speakers in the morning session, they very much rightly mentioned about the lack of validation of the medicine, the drug standardization, safety data, etc., which we are trying to do, spending money from our pocket. As we know, there is no support for R&D for Ayurveda. The safety of the medicine what we give, especially the traditionally prepared medicines like Dr. Shashikumar Nechil sir, who is a 5th generation Rasavaidya. We get medicines from him and we see the safety parameter of this medicine, which is actually clinically also tested and not only lab giving to the patients also. In coming to oncology, many patients come and ask, is there a medicine for cancer in Ayurveda, or stage 4 diagnosed patient, if corporate hospital, big hospitals say nothing can be done, or palliative care, can Ayurveda handle it? The answer is a big yes. This case was referred to me by my uncle, who is a dean of HCG hospital, Dr. Vishal Rao, who is a robotic head and neck oncosurgeon. After surgery, chemotherapy, radiation, the disease recurred. And she was on 6 morphine tablets per day, 10 mg, 6 tablets with pain, planning for end-of-life care. And after starting Ayurveda treatment, we are able to see a remarkable difference. Within 2 weeks, she is off morphine tablet. The tumor has significantly shrunk. One of BMS graduate, he presented this in poster presentation Jamnagar, and he got second place for this. Everything is documented very clearly before and after PET scan. The tumor, which was 8 centimeter, shrunk to 3 centimeter within 45 days. And the patient died after 8 months during 3rd wave of COVID. She did not die due to cancer. Even for pain management, when patients come, I think it is an emergency, even in cancer, to reduce the pain immediately, Ayurveda can significantly contribute. One more case, she was 86-year-old, where after getting diagnosed with multiple myeloma in Manipal Hospital, she was got to Bangalore for palliative care. I admitted her in Shema Hospice, where we feel nothing can be done. We had to give supportive management. And now the same grandmother is playing cricket with her grandkids after 3 months of Ayurveda treatment. There are situations where we have to handle emergency and oncology simultaneously. One such quick example is, this patient is a relative of hemato-oncologist who is working in Manipal Hospital, Old Airport Road, Dr. Mallikarjun Kalshetty. His cousin's son had leukemia, and they were given chemotherapy. They spent 25 lakh, and the disease recurred. And there is a drug by name L-asparginase, which causes pancreatitis. The side effect of the medicine is pancreatitis. So he had the disease, but unfortunately after 6 months of stopping the treatment, the disease recurred. And the patient had pancreatitis along with this, and counts dropped to 300 in spite of filgrastim, etc. They were not able to make out whether it's recurrence, but when did not respond to any medication to increase WBC, they confirmed it is recurrence of the disease or relapse of the disease. And his uncle, who is working in as hemato-oncologist, he counseled that in spite of BMT and immunotherapy, he would not survive. So he came to Shema Hospital with this picture. Can you please play the video of this? His counts were 300, platelet count 20,000, and HB of 6. After transfusion from Sindagi, on the way he traveled, it came to 9. And with severe pain, even after fentanyl patch and morphine, his pain of pancreatitis did not come down. And the same person for whom any pain medication from modern medicine did not help in 15 days, after giving Ayurveda medicine, within 15 minutes, he went into sound sleep. The same kid, after 2 hours, he had a good sleep, and he woke up from sleep and took 1 glass of ganji. For the first time, he took something orally in the last 15 days. And his counts, as we discussed, it was 300, and within 5 days, it went to 6,200, and his platelet without any transfusion. And in this case, I did not give a single paracetamol. I used Jayamangal Rasa in high dose, 2 TID, Ashwatha Chintamani Rasa. For example, we followed the protocol of modern medicine. When a patient is having counts of 300, we give prophylactic, antifungal, antibiotic, antiviral drugs, so the person will not go into sepsis because of opportunistic infection. Same principle I followed and gave the medicines through Ayurveda. And we are able to see a remarkable difference. Within 1 week, his WBC count normalized, and without any transfusion, platelet jumped to near 90,000. Same person who came for palliative end of life care. I got Dr. Anand sir from Sparsh Hospital. He did the bone marrow biopsy. The child went into remission only with Ayurveda treatment within a span of 25 days. And this is a case which was planned for palliative care through modern medicine. And I feel many a times when we get results through Ayurveda, we should present in a very humble way towards modern medicine fraternity. Otherwise, the ego will be hurt. So, as I'm old student of Manipal, I took this report to his uncle, Dr. Mallikarjun Kalshetty. And the patient party went back to their native place without informing him. And the doctor obviously thought that he might have been passed away by now. And when I took the report, he said, "This is unbelievable." And he said, "Thanks for coming and informing." I went to Manipal Hospital and informed this case. This is the outcome of his cousin's son. He said, even if I would have given immunotherapy and bone marrow transplant, the person would not have survived. And he got discharged after he had colitis. For that we planned Yashti Madhukshira Basti along with Prabalagarba Putli, etc. And he came out from the side effects of the treatment. He came out of leukemia, relapsed leukemia. He got discharged. And I shared this information with his uncle, Dr. Mallikarjun Kalshetty. We are able to see him in the center of the photo. He went to his native for a function where he met the child's mother and the family. The same kid who was 18 kg when he got discharged, he is now 30 kg going back to his school. Now we have completed one year of treatment. He is doing absolutely fine. This news spread to Narayan Hridayalaya, Dr. Sharad Damodar sir, and many of the fraternity who are treating the hemato-oncologists. Interestingly, they have shown interest with Ayurveda. And at this point of time, I would like to remember the tough time what our previous generation had, especially Ayurveda fraternity. They had to come ahead of many of the obstacles to convince the allopathy fraternity, etc. Now the doors are open. We have the responsibility to say that it is possible through Ayurveda and make use of the opportunity. And interestingly, I calculated in a span of 1 month what is the quantity of Rasaushadis I gave him. It is 250 gram. 1/4 kg of Rasaushadi was given to a 20 kg body weight person. And we are able to see the LFT. The deranged LFT has become normal. To the right of the screen, we are able to see normalized LFT. And the concept of surgery in Ayurveda is only for wound management as of now, but we are extended to oncology. What Ashtanga has said, what Sushruta has said, we should be able to definitely practice this. And along with that, the Marma Chikitsa, we now plan all the erratic incisions, but I should be conscious about whether it's passing through any Marma point. Should I modify the incisions without compromising the access to the organ? And I think in this regard, Shalya people can club with modern surgeons so as to modify it as per the principles of Ayurveda. When I operate after mastectomy, even the patient is diabetic, HbA1c is more than 10, we apply Jati Adhikrita, Panchavalkala, wash, etc. No antibiotics are given before or after surgery, even if the patient is diabetic. And I would like to introduce one special personality here, Dr. K.S. Charak, who is MS and FRCS Edinburgh, and who is the head of Indian Medical Astrology. I feel when we are having the best of Ayurveda and modern medicine under single roof, now we have the two systems, but unless it comes under single roof, we'll not be able to plug in or exchange the ideas. Why I'm actually proposing these ideas on stage is, if you see the website of Mayo Clinic, they are introducing Reiki Chikitsa in their integrated protocol. They are introducing acupuncture. They are very much going high on integrated medicine, but they don't have the availability of expertise, availability of the Vaidyas or the raw materials, etc. We have everything, but unless the discussion happens between the two fraternity, we'll not be able to get the best of the two systems. And even when we all know that as of now, Ayurveda is given only to reduce the side effects of chemotherapy and radiation. I think these Rasaushadis are not meant to reduce the side effects of chemotherapy radiation. It is meant to replace chemotherapy and radiation. Now, most of the discussion, for example, Dr. Santoshi Narayan, she is old student of Bangalore Medical College and the head of palliative medicine in MD Anderson Center. She was surprised that after having discussion with me, till then she thought for peripheral neuropathy developed due to chemotherapy, Shirabala massage was the solution, or oral mucositis, some Kavala Gandusha was the solution. But I told her that Ayurveda is not slavery. Ayurveda is not to reduce the side effects of chemotherapy and radiation. It is meant to replace in many situations. And we presented our case in Taiwan. We represented our country in traditional medicine conference, where we were surprised to see many fraternity like MD, MS orthopedics, MD medicine, pulmonology, from modern medicine fraternity from Japan, Korea, etc. How they are interested in this surgical aspect of Ayurveda, etc. But they're not able to get the information and practice it. We had good interaction with them. They're interested to have collaboration with our center in Bangalore. And this is in KMC Manipal as a part of Ayu Emergency Yatra. In intensive care unit, we are planning to club Ayurveda and modern medicine in emergency condition, especially in Visha Chikitsa, etc. Our team in Manipal, we had extensive discussion to get out the best of both the system. And before ending this presentation, I'm not trying to say that Ayurveda is superior or modern medicine is superior. I feel what requirement has to be there for Ayurveda, especially insurance for Ayurveda. Now it is there only for wellness, if I'm not wrong. And it is not given for critical conditions. If a patient is on intensive care unit, I have to give some Swarna Kalpas. It might cost 3,000 to 4,000 per day for just 3 to 4 days. It is not supported by any schemes. Or if I have to treat the patient after doing surgery for example, breast cancer patient, we have to keep them on treatment for 2 years with Ayurveda medicine. It might cost 20,000 per month. Patients are not affordable because insurance is not available. At the same time, for injection which costs more than 50,000, 1 lakh, it is freely available through insurance scheme, BPL card schemes, etc. Unless we discuss, and when I was attended to Global Ayurveda Festival, where one of the representative of Mauritius, 30 doctors who are present in Mauritius, their representative had come to Global Ayurveda Festival. And what I got to know, there is surprisingly in government setups for tuberculosis patient, Siddha Makardaja is given free of cost. But in India, we are just offering massage and Chandra Prabhavati, simple medicines. Why are we not able to do it if a country like Mauritius can do it? Today, our MPs go and talk to Nirmala Sitharaman and ask them to remove the tax on immunotherapy drugs. when we are actually seeing big people pitching for Ayurveda at the central and state level, unless we do that for Ayurveda and get insurance for Ayurveda for treating such condition, which is the need of the hour, I think Ayurveda will not be able to come to its full potential. And we say that both are important. It's like two lungs of the patient. And the patient is nothing but the heart. When the two systems work together, patient will be at ease. Thank you. Thank you very much.
Thank you very much, sir. I request sir to be on stage while we request Dr. K.C. Ballal sir to kindly come over the dais and felicitate Dr. Ashwatha Rao for a wonderful and beautiful session with live case demonstrations and showing the true spirit of integration. Ladies and gentlemen, put your hands together for Dr. Ashwatha Rao for being a beacon of hope and bringing in smiles to a lot of families via clinical practice and integration. And a source of inspiration for all the young Ayurveda Vaidyas.